report on the most commonly used central nervous system depressant, benzodiazepines. Today I will be interviewing a pharmacist and an EMT on behalf of the clinical uses and misuses of the drug in our society. Hello and welcome. Today we're going to be talking with our pharmacist, Stacy. Hi, Stacy. How are you today?
Good. How are you?
Good. So we're going to be talking about benzodiazepines. How is it supposed to be used?
It is medically used for anxiety, seizure control, alcohol withdrawal, insomnia, and muscle relaxation.
Okay. How does the body react to the drug, and where specifically in the body?
Benzodiazepine acts as a sedative which slows down the body's function. It specifically affects the brain, and the brain activity is reduced in areas of the brain where it is responsible for rational thought, memory, emotions, and essential functions such as breathing.
All right. And how is it commonly taken?
Benzodiazepine comes in the form of a pill and is commonly taken by mouth.
All right. Well, thank you for your time today, Stacy.
I'm good, Melissa. How are you?
Good. So tell me, what are some of the side effects that come with taking benzodiazepines?
So some of the side effects that we see presented in our patients after they've taken benzodiazepines with their prescribed dosage is just light dizziness, some headaches, some stomach agitation, impaired coordination, tachycardia, which is an increase of heart rate, and some localized weakness in the extremities.
All right. What happens when you misuse it?
So we see that the misuse of benzodiazepines in the field comes twofold. First, people use benzodiazepines as a secondary drug, in which case that is a combination of benzodiazepines and an illicit drug such as heroin that just creates the euphoric high of that drug to an elevated extent. As well as we see people misuse benzodiazepines as a date rape drug because the combination of a benzodiazepine and alcohol could leave an individual unconscious and completely unaware of their surroundings.
All right, and if that's misusing it, what happens when you abuse it?
So abusing benzodiazepines also comes in two patterns. One is the physical addiction that is derived from an individual strictly using it from the high that it relieves, such as the benzodiazepine itself, or as I stated before, benzodiazepine in combination with another drug such as heroin. There's also the pathophysiological addiction that could occur. That's where over the time period of you taking benzodiazepines for whatever chronic illness or issue that you may have, could create a pathophysiological addiction since your body is so used to the consistency of you taking that chemical composition, then it craves that chemical composition along with it. And some of the symptoms that we see out in the field that come with a overdose and from the abuse of benzodiazepines are unconsciousness, reduced reflexes, extreme drowsiness, loss of coordination, and extreme confusion.
All right, well, thank you for your time today, Lila.
Thank you, Melissa.